Now let's get the show started. On the 27th of February, Nigeria confirmed its first case of coronavirus when an Italian citizen in Lagos tested positive for the virus. And on March the 9th, the second case was reported at Ewekoro, a contact of the index case. And of course, since then, it's been busy all over the country. And Lagos State has been the epicenter of the virus pandemic. But Lagos State also has been the most active of all the states, making sure that we are safe, or at least making an effort to make sure that we are safe. I'm not sure that many of us are joining the state in making those efforts to save our own lives. So, a lot has been happening. And we have the Commissioner of Health in Lagos State, Professor Abayomi, with us in the studio this morning to tell us how it's been and how it's going to be. Good morning, Professor.
Morning, ma'am.
Welcome to Sunrise.
Thank you, Alera.
Good. It's amazing I can see your eyes, because I can just imagine how tired you are. You have to tell us on a daily basis what's going on. You have to keep on top of everything. So how have you been managing all that?
Well, I've got this genetic manipulation that I've applied on myself. So I can do without sleep for a few months now.
You want to share the secret?
It's under patent.
Under patent?
For now.
Okay.
For now.
But let's talk about the one that's not under patent for now. The numbers are rising.
Yes.
Are you worried?
I'm worried that the world is in a state of a pandemic. There's nothing unusual about Lagos or Nigeria. Every other part of the world is going to go through this pandemic. And so it's a matter of planning, strategizing, and making the best fit for your environment. You know, the strategy of Lagos is to minimize the damage that this pandemic is going to cause, not to bury its head in the sand and think that, you know, it's not going to happen. Our strategy is to, as everyone's described, to flatten the curve, but all that simply means is spread out the number of infections over a longer period of time so that you don't exceed the threshold of the system, the health system and the logistical system to cope with the outbreak.
But even as you're striving to see that happen in Lagos, sometimes it looks as if the population doesn't really understand what this is about. So, yes, stay home, but you still come out in certain areas, you find a lot of people out, and some of them quite educated. What does that say about us?
Well, I think, you know, everybody's understanding is how to survive. And that may not necessarily be COVID as the priority. Livelihood is the priority. COVID is just a threat to livelihood. But there are many other threats to livelihood. And so in life, you balance those threats and you find, am I prepared to take the risk to mitigate another threat? And that other threat may be hunger. It may be another kind of sickness. It may be your 6 children asking you for money for their day-to-day survival. So what do you do as a head of a home where there's a threat out there, but there's a threat in there, you know? So we have to, I think, be realistic. I think every segment of Lagos requires a slightly different strategy. It can't be, you know, one cap fits all, you know. Someone in Victoria Island doesn't have the same priorities as someone in Makoko, for example. And there is a whole range in between, you know. So I think what Mr. Governor is doing is he's trying to size up all the respective situations. He gets a situation analysis every day. He debates with cabinet. He gets regular updates. Data is very critical. We supply data on a daily basis. And with that data, it helps you to change your policies. And the policies, I can tell you, are changing every 24 hours based on what we're finding, based on hotspots, based on what's going on around the world, based on the research space. Because another reason you want to flatten the curve and extend the time frame over which this virus is trying to infect everybody is to take advantage of the evidence that's coming from other situations around the world. Research, I tell you, the two most important things in an outbreak response are logistics and research. Because when you have an unknown pathogen, you don't know anything about it. You have to find out about it, and you find out about it on the fly. And it's so important to keep in touch with the international research space. And it's important to do your own research, because what applies in China or in America or in Europe, we're a different ethnic group, we're a different environment. So you can't just transpose research from abroad and apply it automatically to Nigeria or to Lagos, for that matter. So we have a research agenda, and we're looking at how the virus is behaving in our environment. But at the same time, we're taking cognizance of what's happening abroad. And this is a very important message that logistics and research needs a lot more attention. You know, I know response is important, but that's really, you can't have response unless you have informed data and informed research information.
Yeah, the reason you just gave, we're a different ethnic group, we're a different environment, we're different people, different countries, is the reason why some people say that a lockdown may work in America, it may work in China, but it doesn't seem to be working in Nigeria, because most Nigerians are people who live from day to day and have to go out every day to look for their daily bread, which is the reason why a lot of them are still on the streets.
So lockdown is a component of social distancing, and there are many factors to social distancing. What you're trying to do is reduce the opportunity for the virus to move from one person to another or to travel. And that's all embedded in the concept of social distancing. Now, how do you talk about social distancing in an environment of Lagos where there are 20 people in one household, 10 people sharing a room, and 20 of those households sharing one ablution facility? You know, the concept is a non-entity. You know, it doesn't make sense. So we must be careful how we define social distancing in certain environments. And then, as you rightly pointed out, if everybody, 70% of Lagos are in the informal sector, they have no safety nets. You know, they live from day to day. What they earn is what they eat on a daily basis. It's not like higher socioeconomic segments of society that have reserves. If I don't have food in my house, I can go to someone I know next door and say, hey, I've run out of food, you know, and they're likely to have some food to give me. But in a high densely populated area, you go next door, they're just in the same position as you are. You know? So it's important that we allow our imagination to infiltrate, you know, what's going on in these segments of society, and make realistic decisions and policies that don't disconnect you from, as a government, from your people. Because you need to put yourself in those kinds of positions and make decisions to balance the public health crisis against the economic crisis, which are just as lethal. And you could have a double-edged sword here, cutting you both ways if you make the wrong kinds of decisions.
You know, you talked about logistics and research. We do know that in the last few days, testing has increased. But how's that working out?
Well, we've said for quite a while now that we've moved from imported cases to community transmission. So we know now that the virus has made several jumps from its original source. And it's a highly contagious virus. It spreads very easily. The difference between corona and a flu pandemic is if you catch flu, you will know you have flu. You'll be terribly unwell, and there'll be no doubt that you're sick. The reason why...
Can you just hold your thoughts?
Yes.
Give us that difference between the corona and the flu when we'll come back from this break. Please stay with us. Thank you for staying with us. We still have Professor Abayomi, the Honorable Commissioner for Health, Lagos State, who is at the forefront, or one of those at the forefront of the fight against the coronavirus in Nigeria. So, Prof, before we went on that break, you were talking about the difference between the flu and the corona and the COVID-19. What's that difference? You said that if you have the flu, you will know you will have the flu. So,
okay. So a highly contagious pathogen will move from person to person. It will have a variable degree of making you unwell, and it will have a variable degree of its ability to kill you. So the flu, when you catch the flu, you get very unwell. Everybody knows you catch it, you get sick, very sick, and a proportion of people will die. With corona, it's different. It's just as contagious, if not more contagious. But the difference is most people don't actually know they have it. So about 60 to 70% of people have a very mild illness, and it's just, you might just feel as if you had a rough day, and that's it, but you're secreting the virus, and therefore you're transmitting it. And then a smaller proportion of people will have a moderate illness, and then an even smaller proportion will have a severe to critical illness, those are the proportion that die. So we have an idea. So that's the difference between flu and, so if you got flu, you're going to be sick, you're going to stay home. So you're not likely to be walking around if you have flu, because you just don't have the energy and you don't feel well, but with corona, you could have it, and you could even be jogging. That's how mild it could be.
Okay. That, I don't know what I'd say. That's even scarier.
It's scary.
The fact that you could be carrying it and not know. Should that now mean that everyone should look for a way to get tested? As many as possible should just get tested.
Well, this whole testing is a very interesting debate. I think it's important to be able to test, but how to test is important, and I think most of the countries abroad that have very large outbreak, remember where we are now at the same time frame, we're only still seeing 70 or 80 new cases a day. I mean, Europe, America are seen in the thousands. So something is definitely different about what's happening here. And we might want to unpack that if you'd like. But so it's just the testing. In medicine, you test only when you can do something about the result of your test. So we have to have a policy that defines our testing rate. And that policy must fit into our capacity and our strategy. So it's if I suddenly test 1 million Lagosians, what am I going to do with the result? You have to have a plan.
Isolate.
Well, isolate them where?
Okay,
that's a very important question. There are different ways to isolate. And those are the strategies that the government is trying to unravel right now.
Okay, if you're testing 1 million, you asked the question, what would you do with them? But what if you don't test and they keep, God forbid, that they carry and then they're spreading it?
Well, the question is, when does testing actually change the narrative? It's obvious from all over the world that you test very early in your outbreak and you test aggressively to contain the early outbreak. And that's just to do one thing. That's to give you time to think and time to put things in place, which is flattening the curve. So right at the beginning of the outbreak, you try and contain as many cases as possible through contact tracing, through isolation and containment. But once the outbreak goes into community spread, and it's just doing what it's intending to do, its intention is to infect as many people as possible. But like I said, in this environment, we have a youth bulge. Most of Lagosians are young. And young people seem to have some degree of resilience towards this virus. We hardly see severe cases in young people. Most of our deaths, we've looked at our death analysis, they're more on the elderly side, and they have underlying risk factors. So now we have to look at our strategy. What's the point testing all the young people in Lagos when, it's not really going to change the outcome. But what we should be testing or looking for is those people who some medical intervention will change the gameplay.
You said something about something being different here than what's applicable out there.
Yeah.
But earlier also, you also alluded to the fact that the virus might be behaving differently in our climate. Would that tie into the notion out there, or some school of thought that says our environment is helping to keep the virus in check?
Okay. So the virus is it's an entity. It's a piece of genetic material. And human beings are also an entity made up of genetic information. So there's a battle between the virus genetic information and the human genetic information. And every human being is different. So just like your fingerprint indicates who you are, your genetic signature is like nobody else's. And in that genetic information, you have the armamentarium to fight off a variety of pathogens. But everybody has a different armamentarium. So the battle between the virus and two people is very different. Somebody is going to win that battle, and it's either the virus or the person. So the person will try to kill the virus, and the virus is trying to kill the person, or at least make the person sick enough so that that person can transmit it to someone else. So I think in the variables in Lagos, the first one we can recognize is the youth population. For some reason, young people do better with this virus. I think our genetics may have something to do with it, and we are thinking about studying the genetics of our population and seeing why so few people get to that severe critical stage. Or perhaps we are going to get to that stage because it's all a numbers game. The more people get infected, perhaps we'll start to see more moderate to severe cases. So it's still early times, and as I said, it's a new pathogen. The whole world is learning how this pathogen works, and a lot of research is required to really understand what's going on around the world and what's going on here.
Now, some people are saying that the numbers are underreported because there isn't really enough testing going on. Like this morning, a lady from NCDC posted something. She was posted to the Amo ward of the area, and she said that the place was just full of COVID positive people. That of every, I think she said 100 tested, there will be about 15 or 16 who were testing positive. And she was advising people not to go to that, if they could avoid that area, that they should. So if those kind of figures exist in Amo ward of it, they probably exist in other areas as well, but we are not aware of it because testing hasn't been going on. We're only aware of this because she's been posted there and she's doing some testing there.
Well, first of all, we have to be very careful about what we listen to on social media. And there's no authentication to that video. I don't know where it came from. I don't know what data she's recounting there. And that kind of thing should really not be happening. That's what we call unofficial, misleading information. Now, it may be that some of the information she's transmitting is a reflection of what the government is doing. We have known that our positivity is in that range. So if we have 100 people who complain of the upper respiratory tract symptoms that are typical of COVID, about 10 to 20% of them will be COVID positive. The rest there are other pathogens that are responsible for all the other features. So COVID is just one of the viruses that causes a cough and a flu-like illness. And there are hundreds. So if you take 1,000 people who have upper respiratory tract infections with slight fever, there are myriads of viruses that cause that. COVID is just one of them. So, when we do our testing now, COVID is the in virus right now. It's the one that's spreading. It's in season. So our positivity is in the range of 10 to 20%. So if you have symptoms and we test you, you have a 1 in 5 chance of being positive for COVID based on our figures at the moment. And that's not peculiar to Amuodofi. It's across Lagos. So there's no need to stigmatize one particular location. We are in the stage of community spread, and we are trying to manage it. We are doing everything possible to ensure that Lagosians are informed. Lagosians can take the appropriate amount of risk based on their circumstances, and that we are providing the right kind of medical support to the people. Remember, this is a pandemic. It's not an outbreak, it's a pandemic. It means the whole world and every individual on this planet is exposed to this virus. And Nigeria's figures are way better than any other figures we've seen around the world. One, because at least in the epicenter in Lagos, we've been proactive. We knew something like this was going to happen since 2015, and the WHO have been telling us it's going to happen. Various think tanks around the world have been predicting it. We lived through Ebola, and we knew what a dangerous pathogen can do. We call these kinds of pathogens, or these kinds of germs, pathogens of high consequence. What that means is that if a pathogen like that gets into your community, there are high consequences, not just to your well-being, but to your economy and your security. So pathogens of high consequence, are on the list. The WHO has a list, and coronavirus was on that list, as is Lassa fever, as is Ebola, and a few other pathogens. And the way the world is going now, we're seeing an increased number of these zoonotic events, what we call the ability of a dangerous pathogen to jump from the animal kingdom to the human kingdom. And that's because we've destroyed our environment, and the opportunity for these kinds of events is going to keep increasing. And we know that in Lagos, and we know that there are peculiar demographic profiles in Lagos. We've been aware of that, and we know that to be successful in Lagos, you have to be on the offensive, because we have a very unusual demographic profile, and we have a relatively weak health infrastructure. And so you don't recognize your weakness and wait for your enemy to come. You go out and you attack it, and you even try and prevent it from taking a hold of your environment.
Is that why we're having quite a number of recoveries happening?
Yes, exactly. I mean, if you go to our isolation facilities, and I go there every day, you hear our patients in there laughing and joking. Some of them are strolling around in their gardens. They're making videos, they're bonding. It's almost like Big Brother Africa in some of these isolation facilities. And that shows you that most of the people are not unwell. We're just isolating them because we want to keep them out of community. But of course, there are some people that do get unwell. And so it's important that we now try and think, as the numbers are increasing, try and think of how we're going to change our strategy to pay more attention to those who are unwell and confine those who are infected but not unwell.
Talking about those who are unwell and those in the front line, there's been that concern about the medical personnel and the doctors and the nurses getting infected. How is that so? I mean, is it that they are not properly equipped with the personal protective equipment, or they don't know how to use them?
Well, remember that, you know, a human being spends time at work and a human being spends time at home, you know, or in a social environment, or, you know, it doesn't necessarily mean that you're getting infected at work. All our staff are trained in IPC, that's Infection Prevention Control, and we're buying large quantities of personal protection equipment. And so a professional, a medical professional in his work environment is supposed to be protected to some extent. Doctors all over the world are getting infected. Nurses all over the world are getting infected. So, as I said, it's a highly contagious pathogen. So it's invariable that some of our health personnel will get infected in the workplace. They're the front line. But it's also possible you get infected outside the workplace because just like everybody else, we live in community and someone could bring the pathogen into your home who is asymptomatic and infect you just like anyone else. So there is a greater risk because you walk into a facility that is full of the virus all the time, but you're trained to protect yourself in that environment. I walk into those environments every day. You know, I know what to do, but I may get infected because of the environment. The risk is higher, but I may also get infected just going, socializing, or having a meeting with colleagues, you know.
Tell us about this insurance that the head of the task force spoke about yesterday for health workers.
Well, the incident commander has already rolled out health insurance a few weeks ago for Lagos. So all health professionals, that's Governor Babajide Sanwo-Olu, all health professionals are on insurance right now, irrespective of whether they're at the front line or in the general public domain. So that's just to protect and to give our health professionals some confidence and some additional incentives under these very difficult and very trying times. So we've rolled that out already because Lagos is the epicenter. We've started this battle since January. You know, we inaugurated the incident command structure first week of January, and our first case was in February. So we took, you know, Cabinet was watching the global trend when it started moving from China to Europe. Of course, you know, we have a great trading relationship with China. So we were expecting something from China. But once it moved to Europe, that was when we really started getting worried because, you know, the Nigerian diaspora is mainly in Europe and America. And so we knew that we were going to get a case and many more. Sooner or later. Either from expatriates or businessmen or from our own diaspora coming home. And that's what happened. So the incident command system was launched well before our index case, and we put as many structures in place, which has given us the advantage. It's not going to stop it, but it gives us a slightly better fighting edge.
Okay. Now, we've heard all kinds of things about how to look after ourselves, maybe to prevent it or to cure it and all that. We've heard about lemon and ginger and what's that plant now? The lemongrass.
Lemongrass.
And all that. Now, you are in the front line of this fight, so I guess that whatever you say to us will be gospel. what can we do to prevent ourselves getting it, one? And if we suspect that we have it, before we run and get ourselves tested, what can we do? Somebody is suggesting, is Lagos State looking at herbs at all, in looking for a cure for this? So please, we would like your advice on that.
Yeah. Well, the most important thing to remember right now is that there is no treatment that is recognized.
No cure.
There's no cure. And there is no vaccine either. And that's why it's called a pathogen of high consequence, because we have no means of addressing this pathogen other than what we describe as palliative care. In other words, we try and soften its blow, and we try and boost the person's immunity. The cure for the virus is the person's immunity. And so do whatever you can to elevate your immunity.
Okay, please, can you just hold your thoughts again one more time? We'll just go on a quick break. We'll come back and begin from that point. Hold a way to immune yourself. We're back shortly. Please stay with us. Thank you for staying with us. We still have the Prof in the house, Professor Abayomi. Prof, you were talking about, I asked you a question about our immune system. The school of thought that the good immune system, I mean, we can fight this. So how do we raise our immune system?
Well, one of the best ways to raise your immune system is sleep.
Sleep.
As the body rests, it allows the immunity to do its job.
And a lot of us are guilty.
Yes. If you get sick with the flu or with corona, the best thing is to stay in bed and get lots of rest and allow your body's energy to be consumed by the immune system, which is trying to do the curing. Of course, you can support yourself with a good diet, with good food. There are lots of natural therapies and that's one thing that we're pushing very hard in Lagos is our traditional medicine. We have a traditional medicine board. We have a traditional medicine research committee. And I believe that there are several natural therapies that we need to investigate. We haven't really been doing much research in this area. The Chinese are very strong in traditional medicine research. And we have a whole ecosystem of plants and herbs. If we haven't destroyed them all by our wanton deforestation, we would have access to a lot of therapies from the environment that we could test out. So that's another important thing. I mean, destroying the ecosystem is what's causing these zoonotic events, and it's depriving us of our natural heritage to find traditional solutions to these problems.
Okay, so let's see if we could take a couple of questions from outside. But before we do that, say this. Well, you said something earlier about knowing that Nigeria was in danger when the virus moved from China into Europe. Was there, and you said Lagos State set up a structure from January. Was there an advice to the federal government to, like, we need to shut down our airports to keep this thing out there?
Well, Lagos is
communication?
Lagos is part of Nigeria, and the Federal Ministry of Health and the Nigerian Center for Disease Control communicate very, very closely with all ministries of health from the states. So there's a national policy and there's a state agenda, and we try and keep them aligned as much as possible. But Lagos is unique, and so there was constant pressure from Lagos to recognize the peculiar nature of Lagos, especially since we get 70% of all international flights. So we needed to be extra careful, and we supported the Federal Port Authority by sending 70 health personnel to the airport. If you remember at the beginning, there were lots of complaints about the laxity at the airport. And then we boosted with permission and on request from the Federal Health Authority, Ports Authority, to support with our personnel. And then it got much better and got tighter. And that was how we were able to track as many people that were coming into the country. But you can't stop Nigerians coming home. And Nigerians were bringing the virus home, which they had contracted abroad. And we had to put most of them on, 14 days home surveillance and isolation. But, people come into this country in various ways and means, and you can't keep track of everybody.
Well, why didn't you do compulsory quarantine? Why in their homes?
Well, if you have a plane load of 300 people and you've got 19 planes coming in every day, you do the maths. Where are we going to keep thousands of people coming in on a day-to-day basis? There's just no infrastructure anywhere in the world to do anything like that. So it had to be self-isolation at home and supervised.
So, okay, supervised.
It was
That's
supervised,
good.
yes.
Okay, so can you just talk us through, again, we haven't even gotten to those questions from the viewers. I hope we can get a few of them in. Talk us through the work you're doing with the WHO in terms of research and all of that. How's that going?
Well, we're doing a couple of research projects. First of all, we're setting up some clinical trials on chloroquine and some of the other antivirals that are proposed to have some effect on slowing down the virus. We're doing some work with convalescent plasma. So if you recover from the virus, your blood is full of certain proteins, which are the antibodies that helped the individual overcome the virus. So if we take those antibodies from a person who's survived, like a blood donation, we process it in the laboratory, we get a package of white blood, and we are storing those white blood packages to use in a clinical trial to see if I give you someone else's immunity, will it help you recover faster? We're reserving that really for the more sick people because, I've already told you that most young people will survive anyway. So we're reserving that armamentarium or that strategy for people who we think we need to rescue. We're doing some trials on the rapid test kits that everyone's talking about, so many home kits or rapid test kits, you just put some saliva or you put a drop of blood and you get a result, No test kit has been validated, and so we need to validate it. That's a kind of research. Then we're thinking of how to engage in genetic research, to try and understand if you have 100 people infected, 60% do well, 20% get moderately unwell, and another 20% get ill, and 5% get critical. So what's the difference? What's the difference in the genetics between those people who don't even know they have the virus and those people who develop respiratory failure and get very sick? So there's something in your genetics that's protecting you. And in that information comes the solution. Therein is the treatment, That's what's called an innovation pipeline. When you get an idea of what's in you that protects you, I can mimic that in a clinical trial. I can get a drug. That genetic component that you have that protects you, I can create a similar scenario, and that becomes a treatment concept.
You see, one of the things that has come out of this whole situation is the creativity of Nigerians. I mean, face masks. At the time we heard, don't wear face masks, it's okay if you don't wear, but now everybody, and indeed almost all governments at all levels have said, no face masks, don't step out of your house. So tell us about this. Besides the fact that it's creating some kind of jobs, there's also the environmental side, the management of the waste from waste. But tell us about the face mask.
Okay, so Lagos has a face mask policy, and any moment from now you're going to hear it. And
okay.
you're going to get a blast. The reason we've delayed it this far is because we don't want the general public to wear medical face masks, because we're finding it difficult to find them on the market. And if 2 million people suddenly go out and buy medical face masks, then our frontline workers have nothing to wear. So we're developing these homemade masks, which don't protect you, but they don't protect, it doesn't protect me. This doesn't protect me from corona, but it protects you. If I have corona and I'm secreting the virus, if I wear the face mask, I'm able to reduce the droplet into the environment. So the masks are, you wear it, I wear it, we both protect each other, depending on whether you're positive or not.
Okay.
So we're going to come out, we want to trend it. We want to put it on with the same pockets,
You know,
handkerchief.
a fashion statement.
If you have a hat or a scarf or you have a gilly, make it part of your life, And so the government is incentivizing a few people in that trade with some kickstart funding. It's pumping some money into the economy, but we want Lagosians to run with it themselves.
Okay. Okay.
They're running already.
Okay, it'll be good to get all manner of designs that are coming out. I like
interesting,
I
yes.
like your look. I like the one you're wearing.
Yeah.
And this is not gray hair, by the way, it's silver.
It's okay for the viewer who. All right, so we have a tweet, a question, mail.
Yes. Somebody is saying, well, we haven't got his name. He says, don't you think that we should develop some kind of indigenous way of combating this virus? This is because the social distance directive has not exactly been adhered to. I mean, check out the markets, for instance. He says, look at mile 12. There are lots of homes where there are too many people sharing rooms and bathrooms. So what do you suggest? You spoke about this earlier.
Yes, I did speak about this, and thank you for that question. I think Nigerians do need to look inwards a bit more. I mean, I think God created a solution for every problem, and I think in our ecosystem there is one or two or several plants or biological entities that is the solution for coronavirus.
And we'll find it.
And we should find it, yes.
Amen. Okay, there's a list of some hospitals on social media saying some hospitals have been infected by COVID-19. How true is this? If truly they've been infected, can residents still visit these hospitals? And then have we evaluated the effectiveness of the lockdown in limiting the spread of the virus? I say this because despite the lockdown, the number of those affected in Lagos still continues to increase.
So, as I told you earlier on, people will have the virus and not know. And they may go in for a routine checkup. They have high blood pressure, or they have diabetes, or they need a surgical procedure, or they're in fact even pregnant. So you're going in for your regular medical checkup, and you're infected. So naturally, you're going to infect the people in the hospital, the doctors, because they don't think you have the symptoms. But some people do go to hospitals with fever. It could be malaria, it could be COVID, it could be flu. And some hospitals have been inadvertently affected by some patients. Staff have gotten infected. The virus is in the environment. And so it's almost impossible to protect any medical facility now from COVID-19. All they can do is take precautions to limit it. Where it overwhelms a facility, they reach the Ministry of Health for help. And we go in there through our facilities management agencies, our accreditation agency, our asset management agency. And we help to restore the environment, to isolate and test the staff and some patients, and to train their staff so that in the future they're better prepared. So that's what the government is doing for the private sector. We've also asked the private sector if they're interested in participating in the COVID response. They're welcome. But it has to go through an accreditation process. It's a very strict process. We come in, we examine your facility, we train, we divide, depending on what you want to do, we divide your facility into COVID and non-COVID. Or some people just may choose to become totally COVID. Or some people may decide they don't want anything to do with COVID. And therefore, they have to triage people outside the building and say, look, I think your symptoms suggest COVID. And we're not a COVID facility, so please go to a COVID, either government facility or any other private facility that has opted.
Would they be allowed to put up a signage to say this is a COVID accredited area?
Yes, so the agency, the HEFAMA agency, once it is satisfied that your staff are trained, that your infrastructure has been rearranged, that you understand what infection prevention control and the principles of biosecurity and biosafety. Once we are satisfied, then we give you a certificate.
Okay. Conscience of Truth, or Alpha Olive, says, why can't the government stop this policy, considering that many medical professionals are getting infected during these deliveries? Again, why are medical workers working without PPE at Amuo MCA?
So, first of all, as I said, as frontline workers, you're at risk. You don't go to war and not expect to be in the line of fire. The chances of a bullet hitting you in the battlefront are high. Similarly, the chances of a virus, of you getting infected by a virus is high. That's our job. That's what we signed up for. And those are the risks we take every day. PPE is a very interesting question. The virus is not Ebola. The virus is airborne. Ebola is contact-borne. So in the Ebola outbreak, you saw the typical complete suit. Because if somebody has vomit on their hands or diarrhea or whatever, or any secretion, and they touch you on your skin, Ebola will infect you just by mere contact. But corona doesn't do that. You have to breathe in corona. It has to go in through your mouth or through your nose. And therefore, the most important aspect of your body to protect is your head upwards. And it's particularly your mouth, your nose, and your eyes. So that's why you see around the world, people are wearing these sophisticated nose masks, goggles, and a face shield. And that's all you need. Of course, you wear your gloves and you wear a gown, a simple apron. Because even if corona touches you on your hand, it's not going to infect you unless you push that hand into your face. So there's a clear difference between Ebola and corona, and we must understand the science of how these viruses are transmitted and protect our staff appropriately. If you put on that big gown, it's so hot, you can't work in there for more than an hour. It's uncomfortable. It's not really protecting you. There's a limit to how much you can do in an hour, whereas you've left your face exposed. So really, this is where we need to protect. And you need to put something on your body that's light, cool, of course, with your gloves. And then you become dexterous.
On a lighter note, so we should talk to Lagbaja to borrow some of his masks, right?
That's right. Lagbaja set the trend.
He said the trend. He had the idea for years. Okay, this is one of the final ones. Real quick, because I still need to ask you one more thing about you.
Yes.
We're entering the rainy season. How would that affect, and it'll be cold and wet, and we do know that during that period the flu increases and all. So how would that work with this?
Well, as the weather cools down, people get the common cold and the flu and things like that. But remember, corona is a cold virus. You know, most colds are caused by other strains of corona, not COVID-19, COVID-20 if you like, or COVID-25, whichever one you want to call it. And besides, you know, corona is everywhere, in all wildlife, in a bat, in a rat. There are thousands of coronaviruses, you know, not COVID-19, but they can just be as dangerous. So it's very important that we manage wildlife and that we don't expose ourselves to the environment in such a way that, you know, we come into such close proximity, like eating, you know, a bat or eating a rat or a rodent, you know, without due process.
Okay, Prof, why should anyone trust you? Yes, you come with your resume is quite impressive, and you're one of those people that you look larger than life. But here you are, simply sitting here. What makes you different?
Well, it's not me, it's the cabinet.
Besides Babajide Sanwo-Olu, His Excellency, you're the next man out there.
He's the commander, yes. So he's the commander. I'm just his deputy.
Yeah, but when we look at you, I mean, you look quite drained, but yet you still speak with this calmness. What is it that makes you different? Yeah.
Who am I? Is that what you're trying to ask? Well, I'm a medical doctor. I'm trained in internal medicine. I also did pathology, and I subspecialized in hematology. I did environmental health, And I subsequently went on into the area of biosecurity. And that's important because I know that the future of the world depends on how we treat the environment and the intersect between environment and humanity. And that's the principle of biosecurity, that we secure our biosphere. And if you mistreat your biosphere, the biosphere will mistreat you. And you don't want Mother Nature as your enemy.
I can assure you that from now on, you're going to be my partner's best friend because he is the environment. Echo of Africa.
Professor Abayomi, I am glad to meet you. And I'm sure the rest of Lagos is glad to meet you. And my producer is glad to meet you too, because she's also an environmentalist. And what you do, and you and your team, all of us in Channel TV, the whole of Lagos, and indeed Nigeria,
We got all the
we
tools.
have your back. Thank you for giving, and thank you for standing strong. And please be encouraged to keep pushing.
In fact, someone did say that we had no business having you in person in the studio because you go to these endangered areas every day. So they're afraid of you giving us the virus.
Don't worry, when you leave, we'll disinfect us. Thank you so much.
It's been a pleasure. Thank you very much.
Thank you. So Professor Akin Abayomi, Lagos State Commissioner for Health. We've been having a chat with him, a very interesting chat indeed, and we'd like to thank him very much for the work that he's doing, showing the gratitude of all Nigerians and all Lagosians. Thank you once again, Professor.